The coronavirus outbreak in New York City is taking a toll on the medical professionals at the front lines of this crisis, a growing number of whom are getting sick. A nurse at the Jacobi Medical Center in the Bronx who had contracted the virus told the New York Times, quote, "I feel like we're all just being sent to slaughter." The Times spoke to another nurse from the Long Island Jewish Medical Center who said it's literally wash your hands a lot, cross your fingers, and pray. The Wall Street Journal reports that NYU Langone Health has told emergency room doctors that they have sole discretion over who gets to use ventilators and that they should think critically about it. Some physicians were unsettled by that directive. One told the Journal, "As a doctor, I don't know how to make the call," adding that it seems, quote, "way too close to playing God." Let's bring in Dr. Stephen Corwin. He's president and CEO of York-Presbyterian Hospital, one of the largest hospital systems with 10 hospitals and more than 200 primary and specialty care centers in the New York area. Dr. Corwin, thank you so much for being on. Any new numbers that you have to share? But also the bigger question I have, are there any new ways to help protect healthcare workers who are exposed on a daily basis?
Well, thankfully, after we last spoke, our mask situation is much better, particularly the N95s. We're treating everybody who comes into the hospital as if they have COVID. We've partnered with Columbia University to develop face shields, which we're 3D printing. So although the mask situation is still far from ideal, it's better. And as you know, if you can't protect your workers, you can't protect patients. So we're in a better situation there. We are going to be short of ICU beds and ICU ventilators as well. So currently, we have about 600 ICU beds. We're going to surge up to about 1,100 ICU beds.
So, Doctor, I believe the last time we talked as well, and the idea was out there, other countries are using hotel rooms and things like that, dormitories, to separate healthcare workers because they get exposed and they go home to their families or they get sick themselves, and a lot of them are really scared. Why hasn't that idea taken off? Is something else being put in place to create some separation between the sick and those on the front lines?
We have 700 hotel rooms that we're using. We're using dormitories at Columbia University, and we're using dormitories at the medical school. So we have about 700 healthcare workers now that are domiciled in those facilities, thanks to the generosity of Columbia and, for that matter, Cornell. So you're 100% right. The other thing that we're doing is we've ramped up production of scrubs. We want people to wear the scrubs in the hospital, and then we will launder them for them so they don't have to bring their clothes home and potentially contaminate their families.
Amazing.
Dr. Corwin, it's Willie Geist. Appreciate you coming on this morning. Can you just tell us about what your doctors and nurses and healthcare professionals are going through on a day-to-day basis? Take us inside that room. I spoke last night to a surgeon who works in operating rooms, who is now retraining and brushing up on ICU skills and things that she will need to know coming up here in a couple of days. What is it like right now inside the ICU and the ER of your hospital?
It's tough. The stress, the trauma that our physicians and frontline workers are feeling is really enormous. Our environmental service workers, it's really quite difficult. As I said before, we've converted operating rooms into ICUs. So ordinarily, we operate about 500 ICU beds. We surged to 700 ICU beds, and this past weekend, we made the decision to surge to 1,100 ICU beds. The only way that you can do that is to actually create ICU beds out of operating rooms, out of general floors, and our construction people are working night and day to do that. Then you have to staff them. And to your point, we've asked all of our physicians who have any critical care experience help in the critical care units, especially if you're no longer operating as a surgeon. So it's tough, and it's going to get tougher. We expect the surge to happen in another 2 to 3 weeks, and we're going to be up against it, to be honest with you.
Doctor, we want to certainly thank you for everything you're doing, and certainly everybody that works with you on the front lines. Let me ask you, though, before you go, what is your greatest need? What are the healthcare providers' greatest need right now, whether that comes from the private sector, comes from the state government, or comes from the federal government? What do you need right now?
Ventilators. We're going to need more ventilators. We calculate that we're going to run out of ventilators by April 10th or 11th if we don't get more. I think that that's going to be the rate limiting feature. I think we can create the bed capacity, as I said to you, and our staff is going to get very, very stretched. We currently have a number of staff, physicians and nurses who are in our ICUs not doing well. So I'm very worried about the staffing as well. So it's a combination, Joe, of all three things. Do you have the staff? Can you protect them? Can you create enough facilities? And do you have enough ventilators?
All right, Dr. Steve Corwin, thank you so much. President and CEO of New York-Presbyterian Hospital.
Thank you.
We really appreciate the comeback, you coming on. We appreciate the update, and please come back soon. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.